Hello, everybody. My name is Greg Simon, and I'm rare. You are rare. We are all rare. And I hope that in the future we can be rare for the right reason, is that we've found a way to eliminate some of the things we can control that are rare, like people not collaborating, like people not sharing information, like people not supporting rare research. And then we can deal more quickly with the things beyond our control, like genetic conditions and debilitating diseases. And that's what we're here to celebrate today, is a collaboration that is turning what was once rare into something that we can now say should be the standard. You know, one thing that's rare is a paper napkin. And a paper napkin by itself is not rare, but a paper napkin on which 3 people wrote a plan that turned into a program, that turned into something that became a clinical trial, that turned into an award, is a really wonderful, rare thing, and also a boon for the paper napkin industry. This award is going to celebrate a particular collaboration among a very special group, the University of Kansas Institute for Advancing Medical Innovation, the Leukemia Lymphoma Society, and the NIH, which sat down around that paper napkin. They probably thought they were there for dinner, and decided that they would do something they hadn't done before, which was to have NIH allow a nonprofit to license out a development and turn it into a treatment. And that treatment, Arinofen, is now a treatment for chronic lymphocytic leukemia, CLL as it's known. And in 11 months and in less than $1 million, it went from an idea to a clinical trial with patients. We hear all the time that it takes billions of dollars and years to do anything. Don't believe it. We can move faster, we can do better, but you have to do something that's rare. You have to collaborate outside your comfort zone. So these 3 groups, at the University of Kansas, which had support from the Kaufman Foundation, the NIH, and from the Leukemia Lymphoma Society, decided that they would do something rare, and that's what we're here to celebrate today. This is just the first project that they're going to do. They have many others in sarcoma, as an example, that can affect the health of thousands of people who have these conditions and diseases. But even more importantly than the immediate impact, this is the seed that's going to lead to fields of collaboration, and we hope harvests of therapies and treatments into the future. So now let me honor the people who did the work, and please join me in honoring this year's Champion of Hope Award for Collaborations in Science, US, us, the Learning Collaborative. Accepting the honor for the group is Scott Weir, the University of Kansas School of Medicine, and Jim Casper, Sr., Director of Research at the Leukemia and Lymphoma Society. We'll do a picture and then we'll take over. All right. I get in the middle. You guys shouldn't have, you can't be next to each other too closely.
Well, thank you, Greg. Our message to you today is a simple one. Thanks. Thanks, first of all, to Global Genes for the opportunity to be here and for this wonderful recognition. It's an honor to be acknowledged by a group that is doing such great work in the fight against rare and neglected diseases. Your advocacy and efforts in organizing events like this one help bring us all together to move forward towards a common goal. At the University of Kansas, we've learned we can't do this alone. So thanks as well to our partners, who we value tremendously and without whom our work would not be possible. By working together with the Leukemia Lymphoma Society and the National Center for Advancing Translational Sciences at the NIH, we've learned that by creating synergies, we can advance new therapies and cures faster, a whole lot faster. By working together, we formed our lightest weapon in the fight against blood cancers, a public-private partnership that we call the Learning Collaborative. Each of us brings unique and extensive pharmaceutical industry experience. I lead a group at KU we call the Institute for Advancing Medical Innovation. In Kansas City, we've assembled a group of national experts in drug discovery and development, and we're creating new ways to get better cures to patients faster. The National Center for Advancing Translational Sciences, or NCATS, is a division of the National Institutes of Health. In addition to industry experience, NCATS brings laser-like focus on rare and neglected diseases. The Leukemia and Lymphoma Society, we like to affectionately say, is not your grandmother's charity. It has a worldwide network of blood cancer experts, funds about 400 active projects each year, and directly invests in new treatments for patients they represent. We've learned that academic, government, and disease philanthropy organizations can achieve greater success together rather than working alone, and we're getting results. We're evaluating an FDA-approved drug for rheumatoid arthritis as a treatment for chronic lymphocytic leukemia. This year, standard of care therapies will fail 5,900 chronic lymphocytic leukemia patients. We're trying to help these folks. This approach, drug repurposing, finding new uses for old drugs, has enabled us to advance this treatment from the test tube to CLL patients in 11 months. Building upon our experiences with this old arthritis drug in CLL and adding additional collaborators to the Learning Collaborative and working directly with the Food and Drug Administration, we've expanded this program to tackle another tough blood cancer problem, mantle cell lymphoma. We believe that Oranafin, when given in the right combination with the right drugs, will provide effective treatment for 1,400 mantle cell lymphoma patients who will fail this treatment this year. We passionately believe in this collaboration model, and as such, we've created a new partnership among KU, NCATS, and pediatric sarcoma experts at Children's Mercy Hospital in Kansas City, Missouri, and we call this the Sarcoma Learning Collaborative. Right now, we're actively evaluating promising treatments for sarcomas that we hope will benefit children, adolescents, and adults. Many of you in the room have heard the term the Valley of Death, this insurmountable obstacle between basic research and new treatments for patients. It takes way too long to get new treatments to patients, and it's really expensive. Rather than talking about the Valley of Death, we at the Learning Collaborative focus our efforts on building the bridge of life. Finally, thanks, perhaps most of all, to all of you for being here. If we're going to solve these big problems, we need everyone's help. And the more you're engaged in these efforts, the quicker we can find a new way forward. So keep up the good work, don't give up the fight, and we'll see you on the other side of the bridge. Thank you.